If you have ever had a urinary tract infection, you know how painful it can be. Have you ever wondered what the urinary tract infection's causes are?
Knowing the cause can help you to prevent urinary tract infection from occurring. A urinary tract infection, or UTI, is any infection that is in the urinary tract. The urinary tract includes the kidney, ureter, bladder and urethra. All of these parts together make up your urinary tract, and each plays a special role. The kidneys collect the waste materials from your blood and create urine. The ureter moves the urine from the kidneys to the bladder. The bladder will store the urine until it is full. The urethra is a short tube that moves the urine from your bladder out of your body. One of the primary ways that someone gets a UTI is by getting E. coli into the urethra. This happens after a bowel movement if you wide from back to front. The germs can get into the urethra because its opening is in the front of the vagina. Always remember to wide from front to back. Remember to urinate when the urge presents itself. If you hold your urine too long, germs can be created. Urinating regularly prevents the buildup of germs. Certain types of birth control methods can cause UTI. Spermicides that are used in conjunction with a condom or a diaphragm can lead to infections. Simply having sexual intercourse with or without birth control can cause germs that are in the vagina to get into the urethra. People who have catheters in place are prone to getting UTI. The catheter is a tube that is inserted through the urethra into the bladder. It is used to help those who are unconscious or who have had medical procedures done to them that prevent them from eliminating urine from their body on their own. It is important to keep the catheter tube clean to prevent infection. Those with diabetes get a UTI more frequently than those people without the disease. Diabetes makes it harder to fight off infection in your body. For a complete do-it-yourself urinary tract infection natural remedy, visit www.uticures.com today.
Hi, my name is George McKenzie. I'm not a doctor, but I have some experience as a health reporter and radio talk show host, and medical topics came up quite a lot on that show. You know, I had a bladder infection, also called a UTI or urinary tract infection, for the first time recently, and it was not fun. So I've put together this short video to help you learn a few basic facts about bladder infections and also help you figure out if you might have one. Let's start with some basic information. A bladder infection, which is also called cystitis, is a condition that can cause painful burning and stinging during urination. The pain comes from an inflammation inside the bladder. A bladder infection may also be called a urinary tract infection, which is often abbreviated as a UTI by medical professionals. Bladder infections are more common and less dangerous than kidney infections, which are another type of UTI. In the United States, approximately 8 million people a year visit their doctor because of a urinary tract infection. A bladder infection is caused by germs that find their way up into the urinary tract, which is normally free of germs. Approximately 80% of bladder infections are caused by E. coli bacteria. These bacteria usually come from the intestines, and they can also be found on the skin in the rectal area. From there, they can make their way up the urethra, which is the narrow tube that urine passes through. The bacteria then migrate to the bladder, and once inside the bladder, they multiply, resulting in a bladder infection. For anatomical reasons, this process is more likely to happen in women, so women suffer more bladder infections than men. Approximately 50% of all women experience at least one bladder infection during their lifetime. Some estimates of the prevalence of bladder infections in women are as high as 75%. Signs and symptoms of a bladder infection are really pretty easy to identify. Generally, these signs and symptoms come on quickly, and they can cause dysuria, which is a burning sensation during urination, a mild fever, an urge to urinate often, even though there's actually very little urine to pass. Sometimes urine will be dark or cloudy, and there could also be an occasional bladder spasm. While a bladder infection can be extremely annoying and inconvenient, it's usually pretty easy to treat with antibiotic bladder infection drugs. These drugs begin working right away, and they may relieve some symptoms within a matter of hours, but mild discomfort could also last for several days. It's very important to take the entire prescription from your doctor. Some people stop taking bladder infection drugs as soon as they start to feel better. This is a bad idea, since the bacteria can make a comeback if they're not completely gone. It will probably take 10 days to 2 weeks to clear up the infection completely. You might be tempted to drink less water or liquid when you have a bladder infection because you don't want to urinate as much. After all, it hurts, right? However, doctors recommend that you drink a lot of water because it helps flush out the bacteria. Your doctor may also recommend certain juices or vitamin C. Keep in mind that you may be allergic to certain types of bladder infection drugs. If you develop a skin rash or begin to have breathing difficulties, definitely call your doctor. Also keep in mind, and this is very important, that a bladder infection, if not treated, can become a kidney infection. Bacteria can migrate up from the bladder through the ureters and into the kidneys. A kidney infection can be extremely serious because it can become chronic. If it does, it can result in life-threatening kidney failure. If you want to learn more about treating a bladder infection, check out these books, which can be immediately downloaded from the internet and available for you to read in a matter of minutes. You'll find links to them in the YouTube About section for this video. These will be helpful, but keep in mind you should only and always rely on a doctor for diagnosis and advice about bladder infections.
Urinary tract infections are the most common non-intestinal bacterial infection in the body that account for almost 8.1 million visits to the healthcare providers each year. UTIs are a bacterial infection most commonly caused by E. coli. Up to 40% of women will develop a UTI at least once during their life, and a significant number of those women will have recurring urinary tract infections. The current methods for detecting UTIs are dipstick testing and bacteria culture testing. However, the question still remains.
Is culturing the best method of detecting bacteria for diagnosis of urinary tract infections? The answer is both yes and no. On one hand, culturing is 99.9% accurate in identifying all type bacteria in a sample, and it allows for sensitivity testing. Sensitivity testing is used to determine the effectiveness of the different type of antibiotics in killing a particular type of bacteria. On the other hand, culturing is time-consuming, so doctors do not have enough information about the identity of the infection-causing bacteria to prescribe the most suitable treatment to patients. Consequently, they are forced to prescribe antibiotics most commonly used to treat urinary tract infection. Such indiscriminate use of antibiotics create bacterial resistance to these antibiotics. Not only is culturing time-consuming, it is also costly because culturing requires incubator to grow bacteria in the sample and technicians to carry out these culturing tests. For these reasons, we question whether culturing is the best method for diagnosing a urinary tract infection. Since the effectiveness of culturing tests is being questioned, other detection methods have slowly emerged into the diagnosis market in the effort of replacing culturing. These detection methods include microcantilever, colorimetric, and self-assembled monolayer-based piezoelectric sensor, also called SAM. Microcantilever is a mechanical biosensor that can detect and count bacteria. Although this method is claimed to be highly sensitive, some argue that it is not. The coding of antibiotics is not uniform from one cantilever to another, hence calibrations and precision is always a problem. Colorimetric uses biochemical reaction that changes color to identify bacteria. These techniques claim to detect bacteria at concentration of 10 to the 5 colony-forming unit per mil within 30 minutes, which is much faster than culture tests. However, this ability to detect quickly is not definite. At concentration much lower than 10 to the 5, such as 10 to the 3, reaction occurs much slower. Hence, it could take hours to days to detect. As one can tell, it is uncertain that this method is more efficient than culturing tests. Lastly, SAM piezoelectric immunosensor coats a quark crystal with a layer of antibody to detect bacterial binding. Literature claims to detect presence of bacteria such as E. coli in 30 to 50 minutes. Nonetheless, this detection time did not take into account the preparation time to coat the crystal, which could take hours. This means that in order for the test to be carried out immediately after the doctor ordered it, the crystal has to be prepared ahead of time and stored away. However, from the antibody data sheets, antibody can only be stored for 2 weeks. So in these 2 weeks, if doctors do not order SAM testing, then the preparation effort along the expensive antibodies are wasted. Overall, the actual time of detection and true cost of SAM sensors are undetermined.
In conclusion, despite being well accepted as the gold standard, culture test is not necessarily the most efficient test to detect bacteria for diagnosis of UTI. It does not give clinicians enough information in a timely manner to prescribe appropriate treatments. Because of this, clinicians are resorting to other methods that could potentially replace culturing. However, these methods have their own flaws, hence do not necessarily deliver the results that it claims to. Therefore, more research is needed to be done in order to improve and implement these techniques for future diagnosis.
Hi, I'm Dr. John Schufelt, the founder and CEO of MeMD. Urinary tract infections are responsible for more than 8 million visits to physicians' offices per year. Approximately 40% of women and 12% of men will experience at least one symptomatic urinary tract infection during their lifetime. Symptoms of urinary tract infections vary between men and women. However, there are common signs that can help distinguish the infection. If you are experiencing a frequent urge to urinate with small amounts of urine, a burning sensation during urination, cloudy or dark-colored urine, blood in the urine, foul-smelling urine, back and pelvis or lower abdominal pain in women, or penile pain or discharge in men, you should speak with a doctor. UTIs are common ailments for which patients request online consultations. During an online consult with one of MeMD's medical providers, you'll be asked a series of targeted questions. Be sure to mention if you have a past history of urinary tract infections, as it may change the choice of drug and length of treatment prescribed. Your provider will then discuss their diagnosis and the risks and benefits of various treatments. Your treatment plan may include a combination of prescription and over-the-counter medications. These can be e-prescribed through MeMD. Your doctor may also discuss the advantages and disadvantages of in-person urinary tract testing if symptoms do not improve. Please note, in certain instances, an in-person examination may include a urine test, a pregnancy test, a urine culture, and an ultrasound. If your doctor is concerned that your kidneys have been infected or there is a possibility of another important diagnosis that needs to be ruled out, you may be advised to seek in-person care. Thank you for your interest in MeMD. We look forward to helping you with your healthcare needs whenever and wherever.
Urinary tract infections, or UTIs, are fairly common, especially in women. In fact, half of all women will get a UTI at some point. UTIs occur when bacteria such as E. coli, which are usually found in your gastrointestinal tract and pelvic region, enter into your urinary system. A woman's short urethra means that bacteria don't have far to travel to infect her bladder. Typically, UTI symptoms include a burning sensation upon urination and the need to urinate frequently and urgently. Sometimes the urine can be bloody or cloudy. Symptomatic UTI usually needs a prescription antibiotic. The good news is that your doctor may be able to prescribe it over the phone if your symptoms sound like a routine UTI. But if you are experiencing fever, abdominal pain, back pain, nausea, or vomiting, or if the UTI is a possible relapse of a recently treated UTI, you will need to see your doctor. You might need to have a urine culture taken or be evaluated for a possible infection of your kidneys. To prevent UTIs, drink several glasses of fluid each day. Staying well hydrated may flush out the bacteria before they can cause an infection. It also helps if you would urinate shortly after intercourse. Finally, take frequent bathroom breaks, even when you're busy. Holding in your urine may give bacteria a chance to make themselves at home in your body. I'm Dr. Natasha. Live well.
For thousands of how-to and advice videos on any topic